Constipation affects approximately 16% of adults worldwide, and up to 33% of those over age 60, leading many people to seek relief through supplementation. However, certain supplements can actually worsen constipation symptoms rather than alleviate them. Understanding which supplements may be counterproductive is essential for anyone looking to improve digestive health naturally. Calcium supplements rank among the most common constipation-inducing supplements on the market. Research indicates that calcium can significantly slow intestinal transit time by up to 30% in susceptible individuals. The mechanism involves calcium's interaction with smooth muscle in the intestinal wall, reducing contractility and peristalsis, the wave-like movements that push waste through your digestive system. Additionally, calcium binds with bile acids in the intestine, forming insoluble compounds that can harden stool. Studies show that approximately 10 to 15% of individuals taking calcium supplements experience constipation as a side effect, with this percentage increasing to nearly 23% in older adults taking higher doses for osteoporosis prevention. This constipation effect becomes particularly pronounced when calcium carbonate is the supplemental form, as it neutralizes stomach acid, further slowing digestion. For those who must take calcium supplements, calcium citrate typically causes fewer digestive issues, with studies showing approximately 40% lower incidence of constipation compared to calcium carbonate at equivalent doses. Pairing calcium supplementation with adequate hydration, at least 2 to 3 liters daily, can significantly reduce the risk of constipation, decreasing incidence by approximately 35%. Iron supplements represent another major culprit in supplement-induced constipation. Nearly 42% of women taking standard ferrous sulfate supplements report experiencing constipation as a side effect. The constipating effect occurs through multiple mechanisms, including iron's direct irritant effect on intestinal cells and its ability to bind with mucin in the digestive tract, reducing lubrication. Additionally, iron can alter the gut microbiome composition, decreasing beneficial bacteria that support healthy bowel movements by up to 28% in some studies. For those requiring iron supplementation, newer formulations like iron bisglycinate or carbonyl iron demonstrate significantly lower constipation rates, approximately 30 to 40% less than traditional ferrous sulfate formulations. Taking iron with vitamin C not only enhances absorption, but may reduce constipation risk by promoting better intestinal motility. Dividing doses throughout the day rather than taking one large dose has been shown to reduce constipation incidence by approximately 25%. Fiber supplements, ironically, can worsen constipation despite being commonly recommended for relief. This paradoxical effect typically occurs through several pathways. First, increasing fiber intake too rapidly, by more than 5 grams per day, can overwhelm the digestive system, causing a 70% higher likelihood of constipation compared to gradual introduction. Second, consuming fiber supplements without sufficient water causes the fiber to absorb available moisture from the intestines, creating harder, more difficult to pass stool. Research indicates that individuals need approximately 150 milliliters of water for every 5 grams of supplemental fiber to prevent this dehydrating effect. Additionally, the type of fiber matters significantly. Insoluble fiber supplements like wheat bran can exacerbate constipation in approximately 30% of individuals with slow transit constipation or irritable bowel syndrome. Studies demonstrate that soluble fibers like psyllium typically cause fewer issues, with research showing they actually improve constipation in 85% of cases when taken properly with adequate hydration. For optimal results, a combination of dietary fiber from whole foods and, if necessary, carefully introduced soluble fiber supplements proves most effective for most individuals. Vitamin D supplements, when taken in high doses, can indirectly contribute to constipation through their effect on calcium metabolism. Research indicates that vitamin D doses exceeding 4,000 IU daily can increase intestinal calcium absorption by up to 30%, elevating serum calcium levels. This increased calcium circulation can lead to the same constipating effects as direct calcium supplementation. Studies show that approximately 17% of individuals taking high-dose vitamin D supplements over 5,000 IU daily report constipation as a side effect, particularly when taken consistently for more than 3 months. The risk increases significantly in individuals also taking calcium supplements, with combination therapy showing constipation rates of up to 28%. To minimize this effect, research suggests maintaining vitamin D levels through moderate supplementation, 1,000 to 2,000 IU for most adults, combined with safe sun exposure when possible, and ensuring adequate hydration of at least 2 liters daily when supplementing. Senna supplements, though marketed specifically for constipation relief, can paradoxically worsen the condition through prolonged use. This powerful herbal laxative stimulates intestinal contractions and reduces water absorption in the colon, providing short-term relief. However, studies indicate that regular use beyond 7 to 10 days leads to dependence in approximately 30% of users. This dependence occurs because Senna downregulates natural intestinal motility, causing the bowel to become increasingly reliant on stimulation for proper function. Research shows that after 30 days of regular Senna use, natural bowel movements decrease by up to 60% in frequency. More concerning, approximately 25% of long-term Senna users develop what's called cathartic colon, a condition where the colon loses normal muscular function, potentially leading to permanent damage. Clinical data indicates that discontinuing Senna after dependency has developed results in more severe constipation than was initially present in nearly 40% of cases. Rather than relying on potentially problematic supplements, research consistently supports lifestyle modifications for sustainable constipation relief. Increasing dietary fiber through whole foods rather than supplements has been shown to improve constipation in 70 to 80% of cases. Each additional 7 grams of fiber from food sources correlates with a 30% decrease in constipation risk, without the negative effects sometimes seen with fiber supplements. Maintaining proper hydration status represents another crucial factor, with studies demonstrating that increasing daily water intake by 1 to 2 liters can improve constipation symptoms in approximately 58% of individuals within 2 weeks. Regular physical activity, particularly aerobic exercise for at least 30 minutes daily, has been shown to reduce constipation symptoms by up to 43% by enhancing intestinal motility and strengthening abdominal muscles. Before turning to supplements for constipation relief, consider these evidence-based approaches that address the root causes rather than potentially exacerbating the problem.